Is your back pain actually disc herniation? If you've been struggling with lower back pain, numbness into the legs, or weakness, I'm going to show you how to test for disc herniation, what herniation you might have, and what you can do to start feeling better today. Dr. Jenny Brennicke here, licensed physical therapist, going to walk you through a brief anatomy and what the importance of your intervertebral disc are. The function of your disc is to act as cushions and shock absorbers when you're walking or doing daily activities. They provide flexibility and stability and allow the spine to move freely. Disc damage can occur from poor movement patterns, repetitive stress, sudden trauma, lack of core and spinal stabilization, and not training in all planes of motion. To go over the anatomy of our disc, we have what's called our annulus fibrosus, and this is going to be the outer ring of our disc. This is going to be the most strongest, and it's built of cross-linking collagen fibers. The annulus fibrosus pretty much helps that disc stay in place and prevent herniations. And then we have the inside, which is called our nucleus pulposus. This is going to be the water-filled gel-like structure that sits inside of the disc. This is going to be your main shock absorber and cushion that's going to help distribute forces evenly across the spine. Over time, the nucleus pulposus loses a little bit of its water content and becomes a little bit degenerated, making that spine not able to truly cushion as well as it should. Symptoms can differ based on the severity of your disc herniation. Typically what you're going to see is pain with bending forward, maybe sitting, or even doing some lateral or rotation movements of your spine. You might also have a localized pain in a specific area in the back, or even experience numbness and tingling down into the legs, or even weakness. You might have localized pain in a specific area in your back, or having radiating pain down into the legs. With that radiating pain, you might experience numbness, tingling, weakness on a certain leg, or maybe both legs. Another symptom is when you're coughing or sneezing, you might potentially feel a little bit into the back, or that might increase the symptoms radiating down to your legs. It's crucial to know when you should seek medical attention and when this is a red flag. If you have loss of bowel and bladder control, you have the inability to stand, or you're getting progressive weakness in the legs, or just really severe pain and it's not getting better. It's important to know the classifications of a disc herniation because depending on your classification, it's going to determine your treatment approach. So going from least to most severe of disc herniations, first we have disc bulging. This can also mean disc degeneration. They use them very similarly in physical therapy. This is going to be when the annulus fibrosus is still intact, but that disc extends beyond normal boundaries, and it can be asymptomatic or you might have mild symptoms. Next, we have what's called a protrusion or a prolapse. This is going to still a contained herniation because that nucleus pulposus pushes outward, but the outer annulus fibers are still intact. Then we have non-contained herniations. This is going to be an extrusion. This is when that nucleus has broken through the annulus, but it remains connected to that disc. And then we have a sequestration, and that is when these free fragments, pieces of that nucleus completely separate from the disc and migrate into the spinal canal, and this is when severe symptoms happen and increased risk for surgery. To go over self-tests for a disc herniation, obviously the gold standard is going to be an MRI, but there are cases where a lot of people have disc bulges showing an MRI and they are asymptomatic. So you have to remember that is just a snapshot of picture in time, and it might not be your true symptoms that you're experiencing. The first test is going to be a slump test. So that's going to be where you're going to sit at the edge of a bed and you're going to just completely slump your body. So really bad posture, bring your head all the way down, your neck is all the way down, back, spine. If you already have pain in this area already somewhere in the back, then that is a little indicative that you might have something going on within your discs. But this is also testing a little bit more for nerve irritations and just nerve pathways. So getting that slump test, all you're going to do now is you're going to bring your toe up as you extend that leg up. And you're looking for where do you feel the symptoms into that leg. Is it mimicking those radiating pain that you feel into your leg, or is it just localized back into the back, or where do you feel it the most? The normal feeling is back behind the hamstrings. That's where we should feel that. So if you feel tightness into the calf, you feel it into the back, into your glutes, then that is indicative that you might have a disc herniation. If you bring your head upwards and that makes it better, then that also tells us that those nerves are somewhat involved within that disc. The other test is a straight leg test. So all you're gonna do is laying on your back, and then you're just lifting your leg up into the ceiling, especially within that 30 to 70 degrees of hip flexion is where you're looking to see if you have pain. It's normal to feel hamstring tightness, those kind of things, but we really are looking for low back pain when we're doing this test. When we talked about before, if you notice, all the motions that were really aggravating was forward bending, side flexion, and rotation, but there's one that can actually be used as a treatment, and that is extensions. There's something that's called the McKenzie method, and I use it with many of my patients, Nikki here included, and been very successful with it. It's based off a directional movement pattern. What happens is when we bend that spine forward, those discs actually posteriorly protrude. And so what happens is if we go into extension, what can happen is those discs can actually push anteriorly. So to kind of apply that test, what I'm gonna have you do is you're gonna lay on your stomach here. We're looking to see what do we have when it comes to pain. So you're gonna lay on your stomach, pretty much like if you were about to start like a push-up position, and then all you're gonna do is just gonna extend up, keeping your hips as well as you can onto the pad, and you're just gonna go back and down. I want you to do about like 5 of those. So like I said, we're really just looking to see, does this make our pain better? Does it make our pain worse? once we do a couple reps, we'll kind of ask and see how it goes. But she's not dealing with disc pain right now at all. She's one that she came on my table, penguin sliding on there. She was a good example for these ones. Okay, so what we can do, so after doing a couple of one of those, you can kind of relax, Nikki, is check with yourself. Do you feel like that increased your pain? Did it make it better? Did it make it worse? What we're looking for is something called centralization, where if that pain extends and radiates down to the legs, we want that to centralize and maybe go to just a specific point in the back. There also are progressions when it comes to this. So I would have you first, you can just sit in like a plank position, just on your elbows. And I would just like start with this and just sustain position. So maybe you sit here for like 30 seconds to a minute. If you feel like it's doing something good, you could take a little bit more. Then you'd go into those ones where the press ups like we were just doing, where we're going to full elbow extension. And then after that one, we can do another progression where we're standing. For the standing ones, what you're going to think about doing is having your hands on your hips, and then you're just bringing your spine back into extension and pushing your hips forward. Again, you're going to do these about 8 to 10 times. This is kind of one of those things you can do a lot of. If it makes your symptoms better, I would say maybe you're doing 10 reps for every maybe 3-4 times a day. If this makes your pain worse or it increases, that you might have a sequestered or an extruded disc herniation. So I would go seek a physical therapist or a medical provider to give you more results and imaging if needed, because this is not something that you take lightly. When it comes to treatment and recovery strategies, you want to make sure that we are not working into pain. You want to stay between that 3 to 4 out of 10, but we're never really working into increasing pain. So, okay, if we get up to that point, cause a little bit of controlled inflammation, but we don't want to make things worse. So what you're going to want to do is modify your daily movement so we don't worsen that disc herniation. You're going to want to avoid those deep flexion postures. So when you're sitting, we don't want to sit in a very posterior tilt where we just let our butt and our back push back. We want to think about kind of having that natural curvature of our spine, maybe putting a towel roll or some type of bolster when you're sitting down to prevent that extreme posterior tilt of that back and that pelvis. Rest is not the answer with this. When it comes to lower back pain and any type of pain really in general, if your threshold, you working up here, and we take ourselves all the way down here to rest, what happens is when we're ready to jump back up and get back into our movements, we have to go from all the way down here to all the way back up here. Rather than if we were at this strategy or at this level, then we're to come down a little bit, okay, that's not that much room that we have to jump back up. So that's why rest at the end of the day can actually do worse more than good. So you're gonna wanna incorporate core and spinal stability exercises. A good one is a stomach vacuum. So when you think about doing stomach vacuums, there's lots of videos on my Instagram, so be sure to go check those out. When you think about it, what you're doing is you're taking a big inhale, full exhale, and then driving your stomach back to your spine as far as you possibly can. You're not just thinking about kind of pulling your spine back, you're driving up and in when you're doing that. Hold that for as long as you possibly can. You can start on your back first while you do them, and then you can go to like a quadruped position, and then you can even do it standing or bent over. You can also take that concept of stomach vacuums and bring them into planks. So when you think about a plank, you don't want to just sit in a plank and just kind of let all your guts hang out. You want to think about activating that transverse abdominis and pulling your stomach back to get that core and spinal stabilization. Any hip, cervical, or thoracic spine mobility is free game because you want to take pressure off that lumbar spine. You're going to want to incorporate things that improve your hip and spinal mobility and stability. So doing things like a simple cat camel can be really beneficial, or just wig wags on your back to get a little bit of spinal rotation, but again, we're never working into pain with any of these exercises. For hip mobility, 90-90s are a really good one to just kind of practice that hip mobility and the rotation of our hips, because those compensations might develop into our hips, knees, and even at the ankles when we have back pain. If you're dealing with nerve pain down into the legs, we can do some nerve glides and tensioners to kind of relieve that nervous related pain. So going back to our slump test, we can also use that as a treatment. So again, we're going to go back into that very slump posture. But what we're going to do now, we're first going to do our slider. So this is really just think about that nerve. It's like a piece of floss. We're just moving it back and forth when we're doing sliders. When we're doing tensioners, we're going to be pulling that nerve and stretching it more. So sliders are a little bit more gentle, whereas tensioners are a little bit more intense. So it's kind of depending on your symptoms. Maybe start out with sliders, and then if those aren't too bad, then go into the tensioners. So to start with those sliders, again, you're going to be in that slump posture all the way down. And then what you're doing is, as you bring that toe up towards you, you're going to bring your head back. But you're still staying in a slump posture, but you're just bringing your head back. And then what you're doing is you're pointing your toes away from you as you bring your head back down. And you're only going to do about maybe 8 to 10 of those. More is not better when it comes to nervous related pain, because we can piss off those nerves. So you're just going to be bringing toes to the nose as you come back, and then point your toe away as you bring your head down. So those are our sliders. Now for those tensioners, what you're going to do is still in that slump posture, but our head is going to be up. As we bring our head down, that foot is coming towards us. and then vice versa. Bring your head back as we bring that toe down. If these seated ones are a little bit too intense, you can also go to lying ones. You're gonna grab that leg underneath you, and what you're gonna do is you're gonna bring your toes up to you as you bring your head back, and then you're gonna reverse it. Your head's gonna, and then vice versa. Now what we're gonna do is we're bringing our head up with us. So these ones are very, very intense, so take it a little bit easy when it comes to these tensioners. We're bringing our head up as we bring our toes to our nose. This one, you're not gonna be able to go as far, so really take it easy. Kind of check in with your symptoms, how you feel. Like I said, with nervous related pain, more is not better when it comes to these things. So start with maybe 6 to 8, 10 reps, 1 set, and that's enough. You don't need to do more. So if you're dealing with a herniated disc, try these self-test, treatment, and recovery strategies to get relief. If you don't know where to start and you want an individualized plan specific to your low back pain, apply with the link in my description. I am taking online physical therapy clients, and we can get you an individualized treatment plan specific to what you present with now. If you found this video helpful, be sure to like, comment, and subscribe. Give a big old thumbs up, not a small one, a big one, because we put a lot of work into these videos, and to grow this community and get a little bit more exposure, that will help a lot. So I'll see you guys in the next one.